Amelia, I'm so sorry to hear that you haven't been feeling very well. After conducting some tests, your labs reflect that you are suffering from iron deficient anemia. This is one of the most common types of anemia, and I'm suspecting that this is caused by your heavy menstrual cycles. I'd like to also obtain a stool sample just to rule out any bleeding in your bowel. We could also perform a colonoscopy and a bone marrow biopsy if your symptoms persist. But I'd like to try an iron replacement before we get into anything that's extreme like that. Some common risk factors that can lead to iron deficiency includes menstruation, pregnancy, blood donation, people who are athletes, decreased dietary intake of iron, and recent trauma with blood loss. Common signs and symptoms include fatigue, irritability, fast heart rate, and exercise intolerance. Some of the treatments for iron deficient anemia includes both oral and IV preparations. Treatment will be dependent on the severity and how well the patient can tolerate the preparation. Adults are also recommended to begin a daily multivitamin containing iron to reduce episodes in the future. Advantages to taking the oral supplementation as opposed to the IV supplementation is the low cost, effectiveness, and low risk for adverse reactions. There's also a chance of gastrointestinal side effects, and sticking to the prescription dosing is important in order to keep your iron levels where they should be. If you do end up having gastrointestinal difficulties with the oral supplementation, please let me know so that we can come up with a treatment plan. Lifestyle changes that can affect your iron levels include consumption of food with iron. However, in some cases, consuming food is not enough and your diet still needs supplemented with iron preparations. Some of the foods that are high in iron include meat, seafood, beans, nuts, and fortified cereals. When we're talking about meat, we're talking about red meat, chicken, seafood. Most meats are high in iron, so if you're able to consume meats, those are all good options for you. All right, so we'll get you started on this oral supplementation, and we'll keep an eye on your iron levels in the future, and this should start to help you feel better very soon.